I want to talk about something that millions of men wonder about privately. Curious. Something they have never felt comfortable asking their doctor, something they have searched for online, usually late at night, hoping nobody sees the search history. Whispers. What actually happens to your body if you ejaculate every day? Does it drain your energy? Does it lower your testosterone? Is it hurting your prostate or helping it? And does the answer change after 60? Pause. For most of your life, you have probably received two kinds of messages about this. Either, do it as much as possible, it is natural and healthy, or, hold back, conserve your energy, protect your vitality. Both of those answers are incomplete, and both of them have left men confused, ashamed, or afraid. Sighs. Today I am going to give you the actual science, not a moral opinion, not a fitness influencer's opinion, not a forum post. A board-certified urologist's honest, evidence-based, shame-free medical explanation. Stay with me. This is the conversation you have been waiting for. My name is Dr. Elizabeth Kavaler. I am a board-certified urologist and urogynecologist. I have spent over 20 years in clinical practice. I have counseled thousands of men on exactly this topic. And here is what I can tell you with complete certainty. Thoughtful. Most men have never had this conversation with a real physician, not because the question is inappropriate, but because the medical community has done a poor job of creating space for it. This channel exists to fix that. No shame, no judgment, no extremism in either direction, just biology, just physiology, just honest medical education. Encouraging. So let's begin with the most important thing I can tell you. Here is the honest answer. Pause. Daily ejaculation is neither automatically healthy nor automatically harmful. What matters most is not frequency. What matters most is how your specific body responds to that frequency. Thoughtful. For some men, daily sexual activity supports better sleep, reduced stress, improved circulation, and prostate health. For others, especially as the body changes with age, the same frequency can lead to fatigue, brain fog, pelvic discomfort, and increased urinary symptoms. The goal of this video is not to tell you what to do. The goal is to give you the information to understand what your own body is telling you. Knowledge, not fear, is what gives you control. Let me start with the biology. Curious because understanding the mechanism gives you real power over your own health. Ejaculation is a complex neuromuscular event. It involves the coordinated activation of your sympathetic nervous system, your pelvic floor muscles, and a cascade of hormonal releases. In the moments leading up to and during ejaculation, your heart rate increases, your blood pressure rises temporarily, your pelvic floor muscles contract rhythmically, and your brain releases a powerful wave of neurochemicals. In the minutes and hours afterward, your nervous system shifts into a recovery state. Prolactin rises, producing the feeling of satisfaction and relaxation. Your body begins the process of replenishing what it has released. Sighs. This entire cycle, from arousal to recovery, places a real measurable demand on your body, not a harmful demand, a normal physiological demand, but a demand that changes as your body changes with age. Now let's talk about the 4 key hormones involved, because this is where it gets genuinely fascinating. Curious. Dopamine is your brain's primary reward and motivation chemical. During arousal and the build-up to ejaculation, dopamine surges dramatically. This surge drives desire, focus, and motivation. This is why sexual activity tends to improve mood and mental sharpness in the short term. Thoughtful dopamine is one of the reasons regular sexual activity has been associated with reduced depression and anxiety in research. However, and this is important, it's why I pause, the dopamine system works on contrast. If the system is activated at the same high intensity every single day, it can become desensitized over time. The same reward produces less response. Some men experience this as reduced motivation, brain fog, or flat mood. This is one reason some men feel more driven and energetic on days after rest. Prolactin rises sharply after ejaculation. Sharply. It is responsible for the feeling of deep satisfaction and relaxation that follows. It also acts as a temporary suppressor of sexual desire, the biological refractory period. In younger men, prolactin clears the system relatively quickly. As men age, prolactin can remain elevated for longer. This is one reason why the recovery period between sexual events naturally lengthens with age. It is not dysfunction. It is normal biology, oxytocin. Oxytocin is often called the bonding hormone. It is released during physical intimacy, touch, and orgasm. It promotes feelings of connection, trust, and emotional well-being. Research shows that regular oxytocin release through intimacy reduces cortisol, your stress hormone. Lower cortisol means better sleep, better mood, and, importantly, better testosterone maintenance. This is one of the most overlooked benefits of regular sexual activity. It is not just pleasure, it is stress physiology. Testosterone. This is the question I get most often. Doctor, does ejaculating every day lower my testosterone? Beat. The honest answer is not significantly in most healthy men. Semen contains only trace amounts of testosterone. The act of ejaculation itself does not deplete your testosterone stores in any meaningful way. In fact, some research suggests that abstaining for 7 days produces a temporary peak in testosterone, followed by a return to baseline. But this is a brief fluctuation, not a sustained difference. What does meaningfully lower testosterone over time is chronic sleep deprivation, chronic stress, obesity, sedentary lifestyle, excessive alcohol, not daily ejaculation. Now, that said, if you are already low in testosterone, or if your body is under significant stress, the hormonal demand of very frequent sexual activity can add to an already depleted system. Context matters enormously. Let me be direct about something that most men notice, but few openly discuss. Curious. The body changes, significantly, across decades. Thoughtful. And those changes affect how your body responds to sexual frequency. In your 40s, testosterone begins its gradual decline, roughly 1 to 2% per year. The refractory period lengthens. Recovery after ejaculation takes slightly more time than it did in your 30s. Many men notice that their energy and mood are more affected by frequency than before. This is not dysfunction. This is a normal biological shift. In your 50s, testosterone decline continues. Sleep architecture changes, meaning testosterone production during deep sleep may be less efficient. The pelvic floor may show signs of age-related weakening. Urinary function and ejaculatory function begin to interact more closely. Some men notice urinary symptoms worsen with very high frequency. More on that shortly. Pause. After 60. This is where the individual variation becomes most pronounced. 2 men at age 65 can have dramatically different hormonal profiles, vascular health, and recovery capacity. For some men over 60, regular sexual activity, even daily, remains completely comfortable and beneficial. It supports sleep. It maintains pelvic floor engagement. It sustains emotional connection. For others, the body signals that it needs more recovery time, fatigue after activity, difficulty achieving full firmness, increased urinary urgency, pelvic heaviness, or mild discomfort. These are not signs of failure. They are signs of a body asking for a different rhythm. Learning to listen to those signals, without shame, is one of the wisest things a man can do. Let's talk about the prostate. Curious, because this is where the research is most interesting and most misunderstood. The prostate is a small gland that sits just below the bladder. It produces a significant portion of the fluid in semen, and it plays a central role in both sexual function and urinary function. Here's what the research actually shows. A landmark study published in the Journal of the American Medical Association followed nearly 30,000 men over 18 years. It found that men who ejaculated 21 or more times per month had a significantly lower risk of prostate cancer than those who ejaculated 4 to 7 times per month. Let me be careful here, because correlation is not causation. Thoughtful. We cannot say from one study that ejaculation prevents prostate cancer, but the data is consistent across multiple large studies, and the proposed mechanism makes biological sense. Regular ejaculation clears the prostate ducts of fluid and cellular debris. This may reduce the accumulation of substances that could contribute to inflammation or abnormal cell growth over time. Think of it like drainage. A duct that drains regularly maintains its health differently than one that remains stagnant. Now, for men with an already enlarged prostate or benign prostatic hyperplasia, the picture is slightly more complex. Frequent ejaculation can temporarily increase blood flow to the prostate region. For some men, this may briefly worsen urinary symptoms immediately afterward. For others, it has no effect. If you have prostate concerns, and I encourage every man over 50 to have a prostate evaluation, discuss your specific situation with a urologist. There is no universal rule here. There is only your individual anatomy and your individual response. Here is something that almost nobody talks about. Curious? And it may be the most practically useful thing in this entire video. Ejaculation involves powerful rhythmic contractions of your pelvic floor muscles, specifically the bulbocavernosus and ischiocavernosus muscles. These are the same muscles involved in maintaining erectile firmness and urinary control. For most men with a healthy, well-functioning pelvic floor, this contraction and release cycle is completely normal and beneficial. It is essentially a form of functional pelvic floor exercise. However, for men with a hypertonic pelvic floor, a pelvic floor that is chronically tense or overactive, concerned very frequent ejaculation can actually worsen symptoms. What does a hypertonic pelvic floor feel like? Pelvic heaviness or pressure, increased urinary urgency or frequency, discomfort during or after ejaculation, a feeling of incomplete emptying of the bladder, mild pain in the perineum, the area between the scrotum and the anus. If any of those symptoms sound familiar, please hear this clearly. You may not need to reduce frequency. You may need pelvic floor rehabilitation. A pelvic floor physiotherapist can assess whether your pelvic floor is too tight, not too weak, and teach you the release techniques that can resolve these symptoms entirely. This is one of the most underutilized solutions in men's urological health, and one of the most effective. So when is daily ejaculation genuinely healthy? Curious? And when does it cross into a pattern that drains rather than supports? Let me give you some clear signals from both sides. Signs that your current frequency is working for you, thoughtful. You sleep well after sexual activity. Your energy and mood are stable throughout the following day. Your urinary function is normal, no urgency, no increased frequency, no discomfort. You feel emotionally connected and present, not compulsive or anxious. Your erection quality is consistent and satisfying. If these describe your experience, your body is responding well. There is no medical reason to change your pattern. Signs that your body is asking for more recovery, concerned persistent fatigue that does not resolve with sleep, brain fog, reduced concentration, or flat motivation the day after, increased urinary symptoms, urgency, frequency, or discomfort, pelvic heaviness or mild pain, reduced erection firmness or difficulty reaching orgasm. A feeling that the activity has become compulsive rather than enjoyable. If 2 or more of those resonate with you, your body is giving you important feedback, not a judgment, not a failure. Feedback, and feedback is something a wise person listens to. Before I give you the action plan, I need to say something that I consider more important than any hormone level. Sincere, the shame and stress that men carry around this topic does more hormonal damage than the activity itself. Pause. Chronic shame raises cortisol. Chronic stress raises cortisol. And chronic elevated cortisol suppresses testosterone, disrupts sleep, impairs immune function, and accelerates vascular aging. I have seen patients whose testosterone levels and sexual function improved meaningfully, not because they changed their frequency, but because they stopped hating themselves for it. Hopeful, you have probably been given contradictory, extreme messages your entire life, from culture, from religion, from the internet, from locker rooms. Almost none of those messages came from a board-certified physician with 2 decades of clinical experience. This one does. You are not broken. You are not dirty. You are not out of control. You are a human being with a normal body, navigating normal biology. The goal is not guilt. The goal is understanding. And understanding begins with giving yourself the same medical compassion you would give anyone else. Here is your practical, evidence-based 5-step plan for finding your personal balance. Step 1, track how you feel, not just what you do, thoughtful. For 2 weeks, keep a simple daily note: energy level, mood, sleep quality, urinary comfort, mental sharpness, noted against your activity. Patterns will emerge that are specific to your body, not someone else's. This is your data. Nobody else's applies to you. Step 2, prioritize sleep above all else. Emphatic. 80% of your daily testosterone is produced during deep sleep. If your sleep is poor, that is your most important fix. More impactful than any change in frequency. 7 to 9 hours. Cool, dark room. Consistent schedule. Your hormonal health will respond within days. Step 3, check in with your pelvic floor. Reassuring. If you experience any of the pelvic or urinary symptoms I described, consider a consultation with a pelvic floor physiotherapist. This is not extreme. It is smart medicine. Many men resolve years of discomfort in just a few sessions. Step 4, schedule a hormone panel with your doctor. If you are over 40 and have not had your testosterone tested, get it done. Ask for total testosterone, free testosterone, LH, FSH, SHBG, and prolactin. These numbers give you a complete picture of where your hormonal health actually stands. Frequency decisions are much easier to make when you know your baseline. Step 5. Release the shame actively. This one is not optional. If shame or anxiety is present around this topic, address it directly. Therapy, mindfulness, honest conversation with a trusted person or a compassionate physician. The stress load of chronic shame is a real hormonal and cardiovascular burden. Releasing it is not weakness. It is one of the most intelligent health decisions you can make. I want to close with something personal, sincere. In over 20 years of practice, I have watched men suffer silently over questions like this one, men who were too embarrassed to ask, men who had been made to feel wrong for wondering, men who carried unnecessary guilt about something that is simply biology. Empathetic. You watched this video today. That means you chose information over shame, and that is a deeply intelligent choice. Your body is not a source of embarrassment. It is a complex, remarkable system that changes across your life and deserves to be understood. Your sexuality does not expire with age. Your desire for connection, pleasure, and vitality does not make you inappropriate. It makes you human. And your best years of health, physically, hormonally, sexually, are not behind you. They are built intentionally, with knowledge, with self-compassion, with the right support. Encouraging. You deserve all of that. I will see you in the next video. If this video gave you something useful, please hit the like button. Encouraging. It helps this reach the men who need it most. Subscribe for weekly, honest, doctor-reviewed health content. No clickbait, no shame, no extremism, just real medical education. Comment the word balance below if you want a follow-up video. I am thinking about covering pelvic floor health specifically for men over 50. Curious, let me know if that is useful to you. And share this with someone who has been carrying this question quietly. Sincere. That one share could make a real difference.